The Red Cross is putting out an urgent call for blood and platelet donors as they face an emergency shortage. There is currently less than a 3-day blood supply for most types in Massachusetts. Carolee McGrath sat down with Kelly Eisner from the American Red Cross to find out more.
Right now, we're at a less than 3-day supply of blood nationwide, and what that means, we usually like to keep, the Red Cross wants it to be at about a 5-day level, so that if catastrophically something happened, we had to stop collecting blood altogether, we could still supply hospitals for 5 days. Again, right now that number is less than 3. It's just one of those areas that we start to, we want to get the word out and remind donors that, again, blood lasts about 45 days on the shelf, so even when we know it's coming, we can't necessarily, it's not something you can stockpile.
Right, so tell me a little bit what happens when you go and donate blood. How is that divided up?
Sure, so when you go to a blood drive and you give one, we call it unit, it's roughly a pint of blood, you're actually giving 3 different products. You're giving your red blood cells, your platelets, and your plasma. And the red blood cells are generally, each of those components can go to a different patient. So the person who gets your red blood cells might be preparing for surgery or might have been in a car accident, something like that. Platelets, more than half of what we collect go towards people who are being treated for cancer, because a lot of the chemotherapy programs, they just strip your body's ability to clot blood and to fight off infection, so the platelets help get some of that ability back. And then plasma is often used in something called IVIG. It's a medication that's made from blood, and that can go towards patients with autoimmune disorders, things like lupus, or there's a condition called CVID. It's rare, but unfortunately it's not rare enough. Mm-hmm. And those patients really rely on blood products as well.
And tell us a little bit about some, personal stories when you talk about how critical the need is and how important this is. Obviously, this, saves lives. Can you give us any personal stories that you've come across working at the American Red Cross?
I wish I couldn't. It's one of those, but unfortunately, I've been there a couple of years. We work with this little girl up in Billerica, Jacqueline. She's now this amazingly energetic dancer, middle school student. But when she was a baby, she was born with a congenital heart disorder condition, I guess, and needed surgery almost immediately. I think she was 2 days old when she needed this surgery, and she was at the hospital. Her parents were with them as they were wheeling her into the OR, and literally the doctors had to stop because they didn't have enough of her blood type available for the surgery, so they had to postpone her surgery. And I mean, again, I always start with the fact that she's now thriving, she's healthy, but she's going to need more surgery, and there are so many other children, adults, people that are in that same condition or could be faced with the same condition.
I don't think people realize that a surgery would have to be stopped in that case. And I think maybe that's one of the reasons why you're out there and trying to spread the word, but that is incredible to me.
It's true, because a lot of it is just in prep. Like, for example, I always say I delivered my son by C-section, and I remember in the hospital, they had blood on hold for me. It was in the OR just in case it was needed. Thankfully, in my case, I didn't need it, but it has to be there. And again, it's a product that is constantly expiring. Just, it's,
right.
It's kind of a weird analogy, but I always say you can't just grocery shop once and have food for a whole year. Food expires. Blood is perishable. It expires as well. So we constantly need to have donors coming in and replacing what was lost.
And is it all blood types? Because I know in June you had a push for the missing blood type, but it must be all blood types?
It is. I mean, every blood type is needed. The one that we generally see go first is type O. That's the universal donor. So if you're in a situation where a doctor or an emergency room can't type your blood, there's just not time, you're going to get O negative because they know your body won't react to it. So that one is especially in demand.
Okay. What can people do as far as, organizing a blood drive, or can they just walk in, to a place when it's convenient?
Absolutely. We do take walk-ins. We generally encourage people to make an appointment. It just lets us value your time a little bit more. But we run anywhere between 10 and 15 blood drives every single day. We have brick and mortar blood donor centers all over the state. One here in Springfield, there's one in Worcester, and several around the greater Boston area. RedCrossBlood.org is where it's the easiest thing. You can just type in your zip code and it'll give you a list of all the opportunities that day and in the next couple of days. We also have a blood donor app, which I actually think is very cool. That it's the same thing, you can find blood drives, but then there's also a little bit more information in there. They keep the results of your mini physicals from the last 30 times you've donated blood. So it's like a kind of a little Fitbit, with fitness trackers and all that. It'll tell you what your blood pressure, your hemoglobin levels were that day. And the other thing that's cool about that app is that after you've done your donation, it'll usually a week or two later, it'll send you little updates as to where your blood is in the process.
Oh,
and at
really?
the end, you'll even get a notification. I got one that said, my last donation went to South Shore Hospital, something like that.
So you know where it's going. Is there certain health restrictions that you have to watch out for, for people who are interested but might not be certain that they can do it?
Well, I always encourage people to call 1-800-RED Cross. There you can actually have someone talk you through a particular medication or a condition. A lot of chronic conditions that people think might prevent them from donating don't, like diabetes. As long as it's under control, you're feeling healthy that day. Same thing with allergies or a cold or anything like that. As long as you're feeling healthy that day, you're probably going to be able to donate. Obviously, that decision is made at the blood drive. I mean, the nurse that you're talking to is going to have the final say, but in general, it's not as restrictive as you might expect.
So there's people there to walk you through it. Okay.